Hey everybody, welcome back. We're going to be doing a quick little demo video upon the request of one of the viewers. We were asked to demo how to properly remove a few different types of articles of clothing if a patient presents with an injury while still wearing their clothing. Being as how we are mostly in a clinic setting, we typically don't see this very often. This is more of an urgent care, walk-in clinic, emergency room kind of thing. But we can go over some real quick little basics and some of the stuff that we use to do that, and maybe some little tricks you might pick up along the way. This will be a quick little how-to video, and then we'll move on to other videos after that. We're going to be using the following tools. We're going to talk about the following tools. Anyway, we have a bunch of different types of scissors and shears here that I'd like to talk with you about. Again, we'll go over them real briefly. The basic ER, EMT type trauma shears. These are the little cheapy ones you get. You can pretty much get any kind of EMT or medical supply store. You know, they're relatively inexpensive. These are the ionized. These are the treated EMT shears. Of course, we have the types of Fisker scissors that are probably the most popular in the orthopedic field, because they hold their edge so long and so crisp and sharp. However, as we all know, we cannot use these. We're not technically we're not supposed to use these near the patients because they are actually so sharp, and they do not have a blunt tip like the trauma shears do, and the ones that we have over here we're going to talk about as well. So while I appreciate the quality of these scissors, you won't find me typically using these near the patients. And then lastly, we have the type of scissors you would find in the OR, or maybe the clinic setting, sometimes the emergency rooms, but I have seen these more often, like I said, in the private clinics, and of course when we're up in the OR. These are actually the ones that I would prefer out of all the scissors. These are the ones that I would prefer to use when removing articles of clothing. And I'll show you why in just a moment. Of course, most of us are going to be used to using these primarily because we don't have access to these. But if you do have access to these, I would definitely pick up a pair of these first before grabbing any of these. And I'll show you why in just a moment. And so we'll move on to the demo now. So moving on to the actual patient, you're going to see what we have here, pretty apparent ankle injury, as you can see, foot turned in, swelling, of course. And one of the requests was, how is the easiest or the safest or the most proper way to remove a shoe? And I guess in this case, you know, how to go up the pant leg and the sock and all that kind of business safely. Without causing further injury to the patient. And of course, we have the swelling going on here, so we don't want to hurt that anymore. This kind of borderlines field dressings and field medicine and field EMT kind of stuff, like pre-hospital care. But like I said, we're just going to go over just a few little basic things, and if need be, or if it's requested, we can even go over more like the pre-hospital splinting and stuff like that. But again, we'll just have to see how it goes in the videos. So we're going to go ahead and talk about how to get this whole business taken care of prior to splinting or eventually casting, which would take place after the swelling goes down. So right off the bat, we know that we're dealing with a patient who's injured in a lot of discomfort, and we don't want to move the patient any more than we have to. You can, obviously, the easiest thing would be to untie the laces. And if you start to untie the laces, it should go pretty well. And in a perfect world, you could just untie the laces and just little by little start loosening up. But if you start to go to loosen the laces and the patient starts getting very, very antsy or anxious, or it's actually causing them discomfort, the best thing to do is, in removing the shoe, the best thing to do is just to cut the laces. And again, like we were talking about before, the different types of shears. So your basic EMT, ER, urgent care type shears, these are great when you're going to remove clothing that's loose However, if you have something that's really, really tight and swollen and you start trying to get in there, this is a little bulky. This is a little bit bulky, and that could cause some discomfort to the patient. So again, these work fantastic, and I love these. But if you you switch to something like this or something like this, and even this has a very similar presentation as a trauma shears. And it has a little bit bulkier blade, but it has a nice hook to it that you can get underneath something like laces. But like in this young man, he has his laces very, very tight. So you have to find a gap in there to get in there, which you can here. You can do that. But if it's still super, super tight, or you can't get underneath the sock where it's all swollen right here, and this little bitty hook that you have right here, it's not working for you, then you can switch to the standard, two finger scissors, the Lister bandage scissors. I'm sorry, I had a little mental block there. And again, they're very, very narrow, so you can get underneath the laces, and you can actually get underneath the sock, and it's pretty simple. You just cut the laces, and just like that. It's not a huge deal. And then once you cut the laces, without moving the patient at all, use the tip, the nubby tip, to just flick the laces out, so you're not trying to jam your fat finger in there. Just like that. The laces come out undone like so. I'll put the scissors away for a minute and I'll show you. All you have to do, don't go yanking on them and doing all that stuff that's going to cause them problems. Just get the tongue and lift the tongue up. You just lift the tongue up like so. And then you can open this up, and again, we haven't moved the ankle at all. If you try to remove it at the heel and it's causing them problems, you can take the same scissors, and again, now you're damaging the shoes. So in this particular case, this is a nice pair of shoes. You're trying to avoid that, and you're basically trying to just give them the cost of a new set of laces. And then what you do is you just slide it off, pull the tongue up as far as you can towards you, and you slide it off without moving the foot at all. That's removing the shoe. And then as far as the sock goes, again, you want to stay away from the main area of concern right here. And so what I usually tend to do is wherever you see the actual injury, the actual swelling, I tend to go on the opposite side. Just for patient comfort reasons, you're going to cut down the sock on the unaffected side, and you're just going to, like we did with the shoe, you're going to peel the sock back. I'd like to, since we're down here anyway, I'd like to talk about if you get to a point where you're pulling the pant leg up, and for whatever reason, they're like the young ladies are wearing the tights, or the young men are wearing the skinny tight jeans, or whatever the deal is, or you have very, very tight jogger type pants. If for whatever reason the parents or the patient, and they're very, very upset at the fact that you're about to cut their very, very expensive jeans or whatnot, just a courtesy to the patient, if it's obviously not like super emergent, you're not worried about blood supply and stuff like that, and you have a few moments to give a little bit of patient courtesy. Find the seam, find either the outer seam or the inseam, and if you're going to cut the pants, cut along the seam line, and that way, if for whatever reason, way after the fact, when they're all healed and better and they want to put their nice jeans back on, they can take it to somewhere, seamstress or a shop, a tailor shop, whatever, and they can just sew it right back down the seam, and that way their $100, $200 pants, they're not totally ruined. We're going to move from here onto how to cut around this, like an arm injury or the shirt. So in the event that you have a patient with a upper extremity injury and they're very, very guarded, and they don't want to move their arm for you, or they don't want to swing out, for example, a humerus injuries, shoulders, clavicles, the patients are very guarded most of the time. They will not move their arm for you, especially if it's just happened recently. So what you'll have to do to, so that the MD can get a full exam, as well as, help with the x-rays and stuff, you'll more than likely have to trim the shirt. And what I tend to do when I'm trimming the shirt is I'll usually trim along, again, like we talked about with the pants, I'll trim along the seam line if possible. And what I'll do is, as I work my way to the underarm, knowing that he's not at all going to move this arm for me at all, because we're suspecting a humerus or proximal humerus fracture. I'll show you here in a moment how I work my way around the seam and under the arm using basically, more than likely I'll go back to these because it's so slender and I can get into the crevices. These, of course, the serrated edge that you see on these and the serrated edge that we all know this one has, if it's a thick upper garment like a jacket or something, these will do better. But in a narrow space like under the armpit, this will get in there really nicely without causing them too much movement or discomfort. So what we'll do is we'll work our way up the midline here. And again, I'm only using the seam so that if for whatever reason this particular shirt or football jersey or blouse or whatever it may be is, for whatever reason they want to keep it, or it's special to them, or it has a memory, or whatever the case is, again, you're just trying to do something nice for the patient, I'll cut along the seam line. So if for whatever reason they want to turn it into like a muscle type shirt or something, they can do that. So the shirt's not completely ruined, or it doesn't become like a car wash towel or a dish rag or something. And all I'm doing is I'm cutting along the seam line as far down as he'll let me without moving the arm at all. My goal is to not move this arm, because every time I move it, it's going to upset the patient. And you'll see me here. Now what I did was I went around the posterior side, and it's okay, you don't have to move. I did as much as I could, and then that way I can flare this forward without moving his arm. And you can actually still see the seam where I'm cutting here. And if for whatever reason you get to this part and you can't get under the arm, just bring it forward as best you can and cut away the last remnants of it. Slide it to the back and just kind of work with it. And you'll see that what you have is you've now removed the sleeve. You remove the sleeve. You haven't completely ruined the shirt if for whatever reason they want to keep the shirt. And now you have exposure to what you suspect is going to be a humerus or a shoulder or a clavicle. Even the clavicle injury, you can get to it now and do a nice clavicle exam if you had to. And we'll pause there for just a sec. So that's pretty much a wrap up on just really super basic how to remove a shoe without moving the ankle very much on a very swollen ankle. How to cut the sock and how to go up and down the seam line of the pants, the inseam and the outer seam of the pants, and again how to cut away a sleeve without. I think we did it successfully with little to no movement of the arm. And again, your different options of shears that you have to pick from. And I hope this helps you guys. Again, this was a request from a viewer. So any other requests or any other questions, please feel free to leave them in the comments, and I will do my very best to put those up for you. And have a good day.